Welcome to The Whole Pineapple. I'm Ruby Boris.
And I'm Ann Judge. The Whole Pineapple is a podcast about wellness focused around fertility. And on these weekly mini episodes, we bring you bite-sized ideas for you to snack on.
Like breathing exercises, book reviews. Maybe we'll review some scientific research, or we'll share some wellness and fertility stories from our listeners.
So if you're looking for a tip or a trick related to your fertility and well-being, then you've come to the right place.
Let's dig in.
Well, welcome back to our short snack for The Whole Pineapple. Hopefully you had a chance to listen to our full episode with Dr. Marah Hehemann, but we wanted to do a short snack to talk about something that has been in the news for the last 2 years, but still something that we have a lot of controversy about. We're going to discuss COVID and specifically what we know and what we want to get the word out in terms of impact from both the disease and the vaccination on sperm quality.
Well, welcome back to the podcast, Marah. We're so excited to have you again.
Thanks for having me back. This is a topic that's topical, and it
still,
remains.
I know. I think we hoped we weren't going to be talking about it this much, but
it remains topical. And fortunately, we know more and more throughout the past 2 years about the impact. It would have been really hard to have this conversation even just 1 year ago, but we know more now, more than ever, and we'll continue to learn about the impact of COVID-19 on fertility, probably for both ovary health and testicle health and sperm health, and happy to share.
So what do you want to start off with? Like, what are some of the misconceptions that you hear? How do you want to explain it to our listeners?
One of the central questions, and I think the most important thing to talk about, is the impact of the vaccine on testicular health. I have had patients ask if they should avoid the vaccine because they are sort of in the middle of treatments and if there's a potential negative impact that they would want to avoid. And the answer from our research and from our governing body of both of our fields of reproductive endocrinology and sort of sperm research and male fertility is that you should 100% get a vaccine and that it is not damaging to testicles and sperm production. So that is the position statement, and that is the position that I take with patients. And there is literature to support that vaccination is absolutely safe for fertility of testicles and sperm.
And on the opposite end of that, how does COVID itself impact sperm, if we know?
I think we will certainly know more about sort of long-term COVID or sort of these more simmering, low-level infections in the future. But there's data to support that the COVID-19 virus does get into the testicles and does get into the penis. And I'll bring that up as a secondary sort of point to this. When the virus was causing very high fevers or when it can cause lots of symptoms, those kind of inflammatory reactions that are driven by the virus are absolutely detrimental to fertility of testicle and sperm owners. The impact can be long lasting. We don't know how long, but it, at a very minimum, can occur for about 3 months after the illness takes place. So just to kind of refresh, the time it takes for a sperm to be produced and to mature is about 3 months. So any insult to the testicles, like a virus, whether it's COVID or just, a high fever from some other virus.
Remember influenza, guys?
Yeah, influenza, all those things. Actually, well, this is sort of a little different, but mumps can have a huge impact on male fertility. And obviously there's a vaccine for that too. So really important to kind of even talk about in the same context. The insult takes about 3 months to resolve. So if you had a really high fever or you were really ill January 1st, it may take until the end of March for that to kind of work its way out of the sperm that were being produced at that time.
And are there any expected transient effects if someone does get, say, a fever for a day because of having had the vaccine? Is that expected to also show up, or is it more if you're going to have a prolonged fever?
We don't think so. We know that the potential fevers from the vaccinations are have not been shown to be as severe as the ones from actually having COVID. And so the preponderance of, the majority of the literature shows that the vaccines do not cause these kind of inflammatory effects on sperm that people really fear. And I understand the fear, but that is why we do research. And that's why, it's really important to look at these things so that we can reassure patients that it is safe.
And do you also see, since I know COVID infection is often associated with blood clots, do you see issues with erectile dysfunction post-COVID? Are there issues besides just the sperm quality itself?
Thank you so much for asking that question. As I mentioned, the virus does get inside the penis, and whether it's the viral particles being inside the penis, probably more what you're suggesting, Anne, which is the impact on blood flow and the vascular system and just this inflammatory response that goes on in the body. Yes, we do see that there is an association with ED or erectile dysfunction after having the COVID virus. So just another reason to stay safe, continue to stay safe, and continue to prioritize getting your vaccines and your boosters.
Yeah, and we had mentioned in the long episode about how overall cardiovascular health sometimes can show up in penile health. And one of the long-term side effects of that long COVID are some of those cardiovascular, maybe feeling not as energetic or not being able to tolerate the amount of exercise that you have in the past. And part of that is a blood flow issue too. And that is connected to the penis as well.
Exactly. I think we kind of joked about in the last episode that the body is not separated. The penis health is not separated from the rest of the body. It's all one. The inflammation that may go on in your nose that causes you, or I should say it's actually in the neurons in the brain that cause you to lose your sense of smell, are the same kind of inflammation that's going on in the penis. So absolutely important to think about your whole system and why it may be important to prevent that kind of infection.
Yeah, a whole body approach, even when it comes to COVID. It literally has impacted every part of our lives, including penises, unfortunately.
But I know it's sometimes hard back to remember pre-COVID, but just before all that was when we were still dealing with the concerns with Zika. And I know with Zika, we saw that could have effects on sperm that would still also be related to concern with the health of a pregnancy. That's not something that we see with COVID, right? We're concerned about the quality of the sperm, concerned about ED, but we don't see a concern with if you're trying to get pregnant right after recovery from COVID. That doesn't appear to be linked to birth defects or concerns on that side, right?
Not that we're aware of. I'm sure that's probably being examined, but hasn't been borne out in the literature yet. We have seen that there are COVID-19 particles in semen in the setting of an active infection, but we have not seen that it's sexually transmitted, that it is a respiratory transmission still.
And so you're not recommending people hold off on trying to conceive until a certain amount of time after a COVID diagnosis?
No, but obviously conception is a contact sport, and
the stamina might not quite be there right away. You might have to give your body some time.
Yeah, if you're trying to avoid infecting your partner from a respiratory standpoint.
Yes.
Yes, very good point.
Masks, I guess.
Kind of up close and personal. If you are a cis hetero couple, up close and personal event.
Yes.
There's probably so many people that are listening, or their partners who are listening, that have been impacted by COVID in some way, and they might have concerns about how it's impacted their fertility or their erectile health, their penile health. Who should they talk to?
It is absolutely reasonable to come see a urologist or your primary care doctor, I should say. That is always their door is always open to kind of talk about the issues that you may have, whether it's from COVID or, subsequent to COVID or even before COVID from a sexuality standpoint. There is a lot of stigma around talking about sexuality or erectile concerns, but that is 100% a part of our job as providers, healthcare providers. So please feel free to talk with your primary care doctor and they can get you referred in the right manner. Talking with a specialist in sexual medicine like myself is a reasonable step as well. We're here for you.
Perfect. And that's better than just going on Twitter. So
yes, go to your primary care provider or a specialist first.
Marah, again, thank you for coming back to talk about this topic, and thank you for everything. I think we learned so much and about an area that's often not given the attention that it deserves when we're talking about wellness and fertility.
I'm happy to be here and happy to talk anytime.
Thanks so much. Thanks for joining us for this week's episode of the Whole Pineapple Podcast. We hope it was helpful.
If you know someone who could benefit from hearing the podcast, we hope you'll share it with them.
And don't forget to subscribe, rate, and review The Whole Pineapple on your favorite podcast app. Every rating and review makes us easier to find.
This podcast is sponsored by Seattle Reproductive Medicine and is produced by Audiotocracy Podcast Production. We'll see you next time. Have a delicious week.